Thank you. We're going to talk about healthcare issues. The last briefing we had, we focused on education. Lots of interest and lots of coverage on education in the General Assembly the last few days and weeks. But this morning we talked about healthcare. It's a little bit more difficult to talk about legislation of healthcare. The two big issues that I think we have seen this year is Medicaid expansion, and the other is Affordable Health Care Act. And there's maybe not quite as much hot action on those, but there's certainly a lot of discussion. A lot of you in this room are very concerned about what happens with our health care in Tennessee. And what I'd like to encourage you to do this morning is to ask questions as we talk and have conversations with our panel this morning. Please feel free to raise your hand if you want to ask a question about a certain thing. And be very interactive, because that's why we have them here. And I think it'll make for better discussion. We'll try to get out of here about 25 after or something, and so we'll have you out in a timely manner. First thing I want to do is thank our panelists for being here. Senator Campfield and Massey and Armstrong, representing Armstrong and Johnson. I'm going to let you guys start, if you will, and just pass the mic down so we only have one, and introduce yourself, tell what your district is, and what committees you serve on, if you don't mind. Gloria?
I'm Gloria Johnson, and I serve on health and health sub and full health, and also ag and environment. So I'm District 13 in Knoxville, which goes from Central High School to West High School to Southfield High School.
Good morning, Joe Armstrong, and you're sitting in the middle of the fabulous 50th district. I currently serve on Finance, Ways and Means, Budget Committee, and Transportation.
Thank you, Joe, and thank you all for being here this morning. I'm Becky Massey, and I serve on the Senate Health and General Welfare Committee, the Senate Transportation Committee, and the Senate Government Operations Committee, and I chair the Senate Calendar Committee. And I'm the Senate 6th District, which pretty much goes the width and the breadth of Knoxville, and kind of south of Kingston Pike, and then kind of circles around the halls.
Thank you, Stacey. Campfield, District 7. I serve on the Judiciary Committee, the Education Committee, and the Transportation Committees. My district is everywhere from right around Watt Road, most of Farragut, comes down all around, mostly north of Kingston Pike, some around Cedar Bluff, goes downtown this area right in here, and it goes up along Broadway, up to right where you go over the hill to go in the halls, and that's where it stops.
Thank you. We're going to first talk about Medicaid expansion. I know there's been a lot of news about it, but for those of you who aren't completely familiar with it, we give you a little bit of a background on Medicaid expansion and where we are in Tennessee, and then we'll talk about it. The Supreme Court found the Affordable Care Act to be constitutional, with the exception of the mandate required states to expand Medicaid. Therefore, the federal government stepped in, stated it will cover 100% of the cost of the state expansion for the first 3 years and at least 90% thereafter. There are no deadlines for states to make this decision, and the states can opt out at any time. However, the longer it takes states to expand, the more time they're missing out on the 100% from the funding from the federal government. Governor has expressed some concerns with the plan and offered another solution, which he's called the Tennessee Plan. Under his suggestion, we would use the federal expansion money to buy private insurance for those who need coverage. His proposal states that when individuals are identified as being eligible for the Medicaid expansion group, they would be directed to the exchange. The state would then pay the premiums that are required for these individuals to enroll. The premium payments would be matched with the 100% federal dollars. This plan would use the available money to purchase private health insurance for those who are eligible. It includes co-pays for those who can afford to pay something, therefore they have some skin in the game. The governor recently submitted his proposal to U.S. Health and Human Services Secretary Kathleen Sebelius to make a determination on the proposal that would give Tennessee more flexibility to expand Medicaid coverage. But as of now, Washington has not given us a complete answer. There have been several meetings, but no approvals or denials at this point. Now for the panelists, give us your thoughts, just A, on Medicaid expansion, as well as your thoughts on the governor's idea, and then tell us whether you're in favor of expansion or in favor of the governor's plan for expansion, or none at all, which would be an option. Stacey, we'll start with you.
Fine, the governor's plan is a real nice plan, but I'll be honest with you. I really highly doubt the Obama administration would let anything close to what he wants come to fruition. Even if he did, I hate to say it, the federal government has a bad history of making promises on things and then not following through. They have many times, once people join into programs, they change the programs or change the promises that they make. And then they put in penalties for if you opt out or decide to say, well, wait a second, you're changing the deal midstream. We don't like that, we want to get out. Well, then they put in penalties and say, okay, well, you want to get out, then you have to do X, Y, and Z, like pay back everything you've taken so far, or things along those lines. It's a terrible idea to start getting deep in debt with the government and letting the federal government do too many programs. They just don't follow through. And, you know, with the budget the way it is, I think it's unrealistic to think that there aren't going to be some hard changes and hard cuts coming up. It's going to happen when it happens next year, 2 years. We're going to have to make some hard cuts, and then they're going to start put some things on the table and say, well, yeah, we said 100% for 3 years. They've said that kind of stuff before. And I suspect they'll cut back on some of that and change the deal. And they'll probably say things like, well, if you decide you do want to opt out, then you have to pay back everything you've taken so far, things that they've done before. That's not from me, that's from Justin Wilson, our comptroller. He said, don't do it, it's a bad deal. It's a, what do you call it? He said it's like the Roach Motel. Once you check in, you don't check out. You can't check out no matter how bad it gets. So I don't think it's a good deal. No, I don't favor expansion. There's another thing called the Woodward effect. Everybody expects you're going to get nothing but the best and the brightest, or you're going to hopefully get all the wonderful people that are going to be really healthy. It doesn't really work like that. And you get way more people than you ever wanted. If you look at what happened with TennCare, the same thing happened. It was a nice program, and everybody got what they wanted. It was all wonderful. Wait a second, this thing's going way faster than we thought it was going to. It's out of control. It's eating up a whole chunk of our budgets. That's what will probably happen in year 4 and 5, where we don't have the money coming from the federal government. Even if they did promise and they did follow through for the first 3, years 4, year 5, where are we going to get the money to cover all these people? And if you look at what happened during Bredesen's administration, we had to come back in and start cutting people off. And it wasn't a kind little surgical cut like he promised. It was getting the machete out, hacking away. So, not a good plan, I don't think, long term. It's a lot of short-term thinking. If you say, oh, gee, this sounds good on the surface, it sort of does sound good on the surface, but long term, it's not a good deal.
So I think I hear you saying, so you're opposed to it under any circumstance, including the governor's?
Well, the governor, I just don't think the governor's plan, I hate to say, is sort of a pig in a poke thing. I mean, it's a lot of promise, and it'd be real nice if the federal government said, yeah, we're going to accept your plan, but it's not something they're going to do. So you're asking me to, well, I support something that's impossible to happen. Well, I guess theoretically it's a neat concept, but I don't think it's ever going to happen.
Thank you. Of course, there's a lot of layers and a lot of emotions involving this issue, and it's never totally as it seems. But I don't believe that at the federal level they did a good job of really thinking through all parts of the Affordable Care Act or Obamacare. And it passed without members even reading it, and then the regulations were 10 feet, 12 feet high. So I mean, it wasn't really well thought out. I was very disappointed. We did need some reevaluation of our health insurance system. It's basically we're paying people to go to the doctor as opposed to trying to take care of themselves and get healthy. In our country, if you ever watch any of the maps like, you know, a map in motion of showing the obesity rate going up and things like that. It's critical that we have folks that buy into their health care. I mean, I don't do a good enough job, and we all need to do better. And I don't think that the Affordable Care Act encourages that at all. But I also think that if the federal government really wanted an expansion of more people getting health insurance, they would have been willing to work with some of the states on some out-of-the-box ideas and at least say, okay, we'll let you try it for a couple of years, and if not, then we come back and we really reevaluate. I think the governor's plan is good because it does have some skin in the game, and I would support the governor's plan. But ultimately, like I say, we've got to get everybody to have more buy-in to their own health and work in that direction. I mean, our health care costs are just eating up our whole budget. I mean, it's taken money away from education, it's taken money away from social services and from our roads and everything. And it's atrocious what percentages this is taken from our budget. So we've got to all work better on that. And I was pleased this week, and there was 2 articles in the Sentinel this week about some efforts to help with the childhood obesity rate. And, you know, I'd gone to a 5-state work group this past year on childhood obesity, and it's an effort we've really got to take an interest in.
Representative Armstrong.
Thank you, and it's a pleasure being here. And first, let me say that I think that Medicaid expansion is probably one of the most critical, important decisions that this state has faced in the last 20 years. When we talk about the economics of health care, when you look at our budget, if you look at Tennessee, 15% of our budget is in Medicaid, in Medicare costs. When you look at the healthcare industry in Tennessee, and you can inject $1.3 billion into the total economy. When we talk about healthcare in Tennessee, when we talk about the public as well as the private contribution, you're looking at right around $30 billion that are spent in healthcare in Tennessee. Anytime you can inject $1.3 billion, it doesn't cost taxpayers not one dime. It's money that we have sent to Washington, and all it takes is a vote or actions of the governor's part to do that, to increase. Now, what would $1.3 billion do for the economy in Tennessee? If you take the estimates from the University of Memphis, the Fogelman Business School, you're talking about 11,000 jobs. When you talk about coverage as far as Tennesseans, we're talking about 330,000 Tennesseans who are now uninsured that will be eligible to have insurance. Now, let me say, those 330,000 people, when they show up in the emergency room, by law, the hospitals have to take care of them. So what happens to their costs? They're shifted to people who have private insurance. The hospitals have to shift that cost subquick. We have an opportunity to pay for that uncompensated care to our hospitals. If you go and talk to any CEO, or you can even talk to the housekeepers in healthcare, and they realize how important this Medicaid expansion is. When we look at, there are over 51 hospitals in this state that are in the red, that are on the edge of closing, and it's in rural areas. And when you look at Knox County, when you see that we are the main healthcare source of the region, when those rural hospitals close, where are they going to come? They're going to come right here to Knox County. They're going to show up at the emergency rooms at our hospitals, and we as Knox Countyans are going to be paying for their health care costs. We have an opportunity to do it. When you look for the next 3 years, and each day that ticks by, Tennesseans are losing their taxpayer dollars that they sent to Washington that are not coming back and being spent in the economy here in Tennessee. Currently, we're at $175 million that Tennessee has lost by not expanding Medicaid. When you look to the north and in Kentucky, they've already done it. People in Kentucky are going to get better health care than people in Tennessee. Now, when we talk about people that up to 138% of poverty, that's a whole lot of working poor people. And when you look at the breakdown of who it actually is, 80,000 of those people that are fit in that Medicaid expanded population are children. 45,000 are veterans or reservists, because reserve people that have served in the military, they don't receive the same benefits as someone that's a full-term military. So it doesn't make sense. I'm still waiting to see the plan that the governor has proposed. I haven't seen it in writing. I've heard talk, and I know Darren has talked about it. They talk about it once, but nobody has a plan that can say, here is the plan that Tennessee proposes. Because when I look at the plan that Tennessee talks about, we did that 20 years ago in 1994 when we did TennCare. We expanded our Medicaid to allow people who were the working poor, who didn't have insurance, who were self-employed. We expanded the Medicaid rolls. In 1994, it was the largest exchange of public monies to private entity ever in the history of the state of Tennessee. $3 billion. We paid the premiums of everyone that didn't have insurance. We paid their premiums under the TennCare program. Now, what I hear of the governor's program is a carbon copy of what TennCare actually was. We're missing money, we're losing money here in Tennessee. Not only do our businesses need it, our hospitals need it, more importantly, our constituents and our people need it.
Okay, I think he said a lot of what I wanted to say. He said what he said, and I guess what, the thing that really hits me are all the people that are going without insurance. And I had a cousin die last weekend, and we had his funeral, and he was a veteran, and he had no insurance. And he could not get the mental health care that he needed, and he self-medicated with street drugs. And I think that we could prevent a lot of that if we expanded Medicaid and folks had access to that care that they need. Also, I sit in the health committee and heard reports from the Department of Health, and it's interesting to me, they do an excellent job. They came up with all the numbers of the health department, and their priorities for this year, number 1 is healthy living. Priority number 2 from the health department is access to health. To me, it's kind of a no-brainer. Access to health is our goal. We have the opportunity to take Medicaid expansion. The people I know who are uninsured and not able to get insurance would be happy to have it for a few years if we had to drop it. They'd rather have it for a bit than not have it at all. It was a very difficult. I went to the remote area medical event a couple of weeks ago, just right here in Knoxville. That was created for third world countries, and we had to have folks come in. I went down there at midnight Friday night, and there were about 200 cars in line by midnight, and people stayed up. It was below freezing. People stayed in their cars for 6 hours to wait for them to open up so they could get some health services. And I don't think that we should have to do that. I think we have an opportunity here. We need to help our hospitals. We need to help our citizens. It's going to be good for business. It's going to mean jobs, and we need to make it happen.
All right. The Senate has passed legislation. I think the House has passed it as well, and maybe there was a different amendment on that would make the governor seek and win legislative approval before any implementation. If a plan is approved, if the Tennessee plan were approved or some kind of plan, the governor would have to get legislative approval to implement. So, and that's where right now in the House, or coming back to the House. Is that right, Joe? Have y'all voted on it? You think it's totally passed? Okay. So what does So what does that mean? Stacey, I assume you voted for that.
I did, I'm actually a co-sponsor of it. Not to say anything wrong with our governor or governor's plan, but this doesn't talk about just our governor. There's going to be other governors after this governor. So all we were saying is, listen, if you come up with a plan, if the federal government says we like this plan or that plan or whatever, great, at least come back to us and let us look it over. We're the ones who potentially down the road are going to have to pay for it. It's not saying we don't trust this governor. It's saying we don't know what we're buying. So for us just to give carte blanche to something that we're going to have to balance the budget on is not necessary. And one thing I want to make clear, everybody talks about free money from Washington, free money from Washington. You know, one thing my mom taught me, there's no such thing as a free lunch. Money comes from somewhere. And sooner or later, that money has to be paid back. Right now, we're borrowing a lot of money from a lot of foreign countries and some of our own money, putting our kids in debt. And they say, oh, well, that money never has to be paid back. That's just not realistic. That's to say, we have this humongous debt. And they say, oh, well, we'll just keep printing more. And we're just going to get more and borrow more and spend more. It's not realistic. You can't keep doing that. It does not work.
So, questions from the audience, Jerry. I know you like one. We've talked about the impact on the hospitals that you work with.
I think the impact on the hospitals has been pretty well documented. A lot of money, a lot more right on the edge. First of all, let me say, I appreciate Senator Campfield and Senator Massey's supporting a bill that made it possible for Canova to open the door to our new hospital. So I really appreciate both of your support on that. So I know this is not about being anti-hospital. But from a philosophical perspective, the Obamacare is a Republican program. It was designed by the Heritage Foundation as a response to Hillary Care back when President Clinton was president. I'm trying to get my head around what you could support, because when we work in partnership, we always do better. So we've got a bunch of unemployed, uninsured people out there, a whole bunch of them we're working for. How do we get them access? And is there a program that you could support? Because I know your party's very thoughtful, you're very oriented toward business, you're very oriented toward, we believe in the free enterprise system. This program was built on conservative principles by the Heritage Foundation. What kind of program can we get around so we can support getting people into the system?
Is your question nationally? Or
Yeah, nationally, or the thing has got to be national.
Absolutely.
And so, and then we have to support whatever comes out.
Well, what I would have hoped to have seen, or would have been, I don't believe in working in silos. I believe the federal government wouldn't have shut down if there had been, they brought all the parties together and sat at the same table and discussed, instead of saying, okay, well, what do you think? Well, then, now, what do you think? But they're in separate rooms. I think if we had gotten a bipartisan, House, Senate, the medical experts, people like that, and bring everybody to the table and say, okay, the insurance companies, everybody, and sit there and work out a plan together. Instead of, say, oh, well, this is our plan, it doesn't matter, we got the votes, so don't worry about it. I think you'd have more buy-in, you'd have more skin in the game. But I still believe that there has got to be some personal responsibility. Whether you pay $5 or whether you pay $100 or $1,000, there's still skin in the game. And whether you give volunteer hours in return for your health insurance or something. But that's just a personal thing that I've seen over the years, that when somebody gets something totally for nothing, they don't appreciate it. But my thing would be to not work in silos, get everybody around the table. I've done that time and again on other issues, and it's the best way that you can get to a solution. They say legislatively, if you've got both sides of the issue don't totally like the bill, that means it's probably a pretty good bill because you've come to a good compromise. And that's just the way I like to do things.
To your first question, as it relates to the governor certainly, I didn't support the bill that was taking any authority away. It seems like this General Assembly and the last have been really demising the position of the governor. And certainly, I think that when we go out of session, we have to let the administration do their job. Certainly, if you look at the number of boards and commissions that now the speakers of both the House and Senate are now appointing, and each day we see erosion. Yesterday in the House probably was another turning point of one of the governor's main programs in education, how we have delayed that. But when we, getting back to health care, you know, we have paid our taxes and sent our money to Washington. The Medicaid expansion money has already been appropriated. It's $1.3 billion setting there. If we don't take it, it's going somewhere else. It's going to California. It's going to New York. It's going to those states that have expanded Medicaid. So not asking for our share of our taxes that we sent to Washington certainly won't decrease the deficit. They'll ensure that other folk are able to continue to be able to expand their Medicaid population with a lower percentage. In 2017, it goes to 5%. In 2020, it goes to 10%. If under the old TennCare program that we had, if we got the federal dollars that are available now under expansion, we would still have TennCare at this point. The real reason behind the disenrollment of our program under TennCare because no one else around the state of Tennessee had a managed care program like we did, and we had people coming into the state of Tennessee to receive Medicaid benefits. And so now that all the other states that you have similar benefits out there, that we wouldn't see that type of erosion. When you look at 54% of the people in Tennessee live in counties that border other states. They were coming to Tennessee for health care. That problem has been eliminated. When we were talking back in the 90s and early 2000s, we were all talking about a universal national solution to health care. We have one. And you know, the only reason that I see that we're not expanding is based on politics rather than on the actual policy.
And I too voted against taking away the governor's control on that. I think that we should just allow that decision to be made. And also, going back to other plans, other states have submitted plans and actually submitted a plan and submitted a waiver and gotten them. Our governor's plan is very similar to the Iowa plan. About 90% of the elements are the same. So, you know, if we could work on that 10%, we might get somewhere. I still want full expansion, but certainly just anything that we can do to get folks insured, I would be supportive of.
Another, John,
Was it Senator Campfield like that?
you want to respond to that?
Yeah.
Question was about what I could support. I like the idea of risk pools. I think we had risk pools back many years ago that would allow people to purchase insurance. It kept people in the state, gave them an opportunity to purchase insurance. It wasn't a national program. It was something the states did. It gave everybody a shot to be able to buy insurance. I like the possibility for people to be able to buy insurance across state lines. Our regulations may be a little bit higher than some, maybe a little bit lower than others. People may want to come into Tennessee and buy insurance in Tennessee. Tennesseans may be able to go outside of Tennessee and find better deals to get insurance to cover their employees or cover themselves and be able to get insurance that way. If you say, well, what system do we have where everybody's going to get everything and nobody's ever going to have to pay anything? There is no such thing. It's a socialized mess and it doesn't really work. It's a failed system and it probably won't work here either because honestly, the people of the U.S. are not near as healthy as they are in other countries. So you can say we want to do what other countries do. It would be really a huge negative impact to our economy because I hate to say it, we're not near as healthy as the European countries are, and we have a much larger population than some of those other countries. So for us to say we're going to prop up such a huge portion of our population, which is aging, which is growing older, to say we're going to provide insurance for everybody where they get everything for nothing, it's just untenable. You just can't sustain it.
Jared, does that answer?
Yeah, thank you.
All right, John?
Yeah, set aside policy for a second, just pure politics. Is there any hope that anything the governor could possibly come up with is going to get through the legislature during the Obama administration?
That's an interesting one.
That sort of depends on us what happens to the Obama administration, I think. Are they going to approve anything first off? If they do, would it pass the legislature? I mean, I'll just be honest with you, I'd say it's going to have a very uphill battle. I mean, we're going to look at it a very jaundiced eye because of the impact, the problems that we've had with TennCare in the past. And it's a federal program that we just have the federal government has a bad history of not keeping their promises. So it would almost have to be so written in stone and backwards, forwards, looked over 85 different ways. If I had to lay an odds-on number, even if they approved the governor's plan, and the governor got everything he wanted, I'd still say it probably only has about a 25 or 30% chance of getting passage, federal laid odds.
I'm a little more optimistic. I think it depends upon the program and the long-term cost associated with that plan. And I think that there are reasonable people there, and I think we'd evaluate the plan and work with the governor to see. And if it's something that is viable, I think it could pass.
I share the same sentiment as Senator Massey. I'm optimistic about it. Yesterday, in the House Commerce Committee, which handles Medicaid expansion, you had, for the first time, you had a Republican legislator to cross over the line. He represents a rural area. It's 5 hospitals, all of them on the edge of really going out of business. Representative Kelly Keesley, he made a statement beforehand that this was about his district and not about anything else. So I'm optimistic. I think that it's going to take the public to really stand up. The voice got to be heard in Nashville. I think more support, people understanding that this is not about politics. This is dollars coming into our community, federal dollars that we send to Washington, that we're just saying, hey, we want our tax dollars spent in our community, not somewhere else.
And I always have hope. So I'm going to do everything I can to let people know and make it happen. But, curiously, 63% of Tennesseans in the last polls favor Medicaid expansion. So I would hope that would also be reflected in our legislature.
All right, let's move on. We don't have a lot of time left, but I'd really like to talk a little bit about the Affordable Care Act and just where we are in Tennessee, what you're hearing. Are you hearing from your constituents about the Affordable Care Act? Are you hearing from business owners, more specifically? What is the impact on them? Are they laying off people to the 30-hour rule? Have they stopped hiring? I mean, I'd really be curious what you're hearing from your constituency about the Affordable Care Act in Tennessee.
Well,
implementation.
Yes.
I mean, the Affordable Care Act, right, not the thoughts of the Affordable Care Act. Right. It's not what we discussed.
yeah, I can say that as far as my constituents, I'm hearing a lot who want Medicaid expanded. Going into the salon, and my hairdresser comes running up to me, and for the first time in his life, he's able to get insurance, and he opens his little packet, and it's like $135. I've got everything. He's a diabetic. He's like, I've got full coverage. It paid for my prescriptions, and it was $135 a month, and he's so excited. Friends of mine who are business owners, small business, that might have less than 20 employees, and they're getting that 50% back this year because they provide insurance to their employees. So, I'm completely honest with you when I say that almost everything I've heard back has been positive. business owners here in Knoxville call me and, I got better coverage for almost half the amount of money. That's what I'm hearing all the time, every day. I can tell you story after story. I can give you names of folks. It happens every single day. And quite frankly, I think it's very exciting. People are happy about it. One thing I would like to bring up, and I don't know if anybody realizes this, yesterday we had a vote in the House about schools being allowed to send home information on health care. It was very distressing to me as a teacher. As a student, I remember the first day of school, first week of school, you get your packet of information to take home. And it's, do you need insurance and all that sort of thing. The school just generally sends home all this information at the beginning of the year, but they're going to make it illegal for us to send home any information to families about health care. And anything to do with Obamacare, which is going to be our children's programs and all of that stuff. So I would ask folks if you think that that's a concern, that maybe you let people know, because not allowing our schools to send home that information, sometimes that's the only connection, especially a new family, to a neighborhood, to getting that information.
Gloria, who is they? They?
Well, the bill is Cassidy's, was it?
Yeah, Cass.
And, yeah.
Well, I was just essentially going to say the same thing, and also yesterday we delayed Common Core for another 2 years, which Knox County is in full implementation. It seems like that we're mandating down on local government from the state level, that we blame the federal government of mandating on the states. We're turning around and telling local education associations what to do, LEAs, what to do. Restricting information going into the homes when it can help a family have access to health care. So certainly I think we're going in the wrong direction when it comes to which direction we're going in Nashville.
A lot of the talk that I've heard from businesses have been, they've been thankful that they've had the extra year or so before the full implementation of it, because a lot of your businesses that have a number of employees offer insurance, but maybe not at that greatly reduced rate. And they've had insurance, and budgetary-wise, it's going to be very difficult for a lot of our social service and a lot of our companies that are out there. I know there's a number of people that have tried to get the insurance and to sign up for it, and there have been, they haven't had the same luck as some of Gloria's folks, and it's been really expensive. And they've been shocked. They've basically had sticker shock. So I still think that, and they keep changing the rules midstream, and I think people are not sure which way to go, because, they say, okay, this is the drop dead deadline, and then they change that drop dead deadline. So I think it's keeping everybody confused about what are the rules, what do we need to follow, and how do we need to follow it. So and I know a lot of the young healthy folks, are just not paying any attention to it, and they're just going on, and so we're not going to get the healthy folks into the system. It's going to be more the folks that have the more critical needs that are going to drive the cost up. So I'm usually more optimistic. I'm not as optimistic on that.
I don't know who they're talking to about everybody loving it. Everybody I've talked to says my prices for my policy quadrupled. Or reading in the paper how Blue Cross Blue Shield dropped, I think it was over 60,000 policies. Now, you talk about people who have signed up. In Tennessee, we've signed up about 60,000 people. And before I forget, health savings accounts, I also like health savings accounts. But not a whole lot of people have signed up. And like Becky said, those who are signing up are not the healthy ones. They're the very sick ones. And to say we're going to have a system where, okay, the people who are signing up, they are having one, sticker shock, and two, they're finding out the deductible is so high, they're better off not even having it. So if you have no money, and you say, oh, I've got insurance for $100 a month or whatever, that's great. we've got to come up with the first $5,000 before you even get $1 from your insurance program. It's not really helping anybody, because they say, well, listen, all the things I need are going to cost me under $5,000 anyway, so all I'm doing is buying a program or buying an insurance program policy that isn't doing anything for me. So it's not a very good program. It's costing more than it's saving. It's costing more insurance. More people are being cut from their insurance than are saving, than are getting the insurance. The people who are paying the price are finding huge sticker shocks. Honestly, it's probably going to collapse in about 2 years, if it lasts that long. I give it about 2, maybe 3 years tops, and the whole thing collapses on itself, because what you have is the very sick people getting free insurance. The young, healthy people are not signing up. So the big plan was all the healthy people are going to sign up. They aren't. It's too expensive for them, and it doesn't provide any real service. So you're going to have all the sick people drawing out of the program, all the young people not paying into the program. It's going to collapse.
All right, about out of time, are there questions or comments about Affordable Care Act implementation in Tennessee? Does anybody have a story they want to relay?
I'm curious. I mean, I agree with you that the Representative Armstrong, a lot of those costs are indirectly absorbed in the ER, which you're talking about high deductible plans that are out there, but they also got $0 plans that people can split the bill with insurance companies. So my question is really, what do you say, particularly Senator Armstrong and Representative Armstrong and Senator Campfield, sorry about that. What do you say to those people that don't qualify for federal help? They're below that 138% of the federal poverty line. They don't qualify for TennCare. What do you tell them if they're trying to enroll? I mean, what do they do now? What do you tell them besides just, I'm sorry? I mean, is there anything you guys tell them, or are you plan in place for these people?
I'm not sure I understand your question. You say they're above the poverty line or below the poverty line?
They're in that gap between the federal, they're in that gap between federal government paying for their policy and TennCare paying for some of their policies.
Like I said, I've always said we should have risk pools. We should bring back risk pools.
But
that way
since it's not in
everybody
place right now, what do you tell them? Just SOL?
Well, no, honestly, there's insurance policies out there. There are insurance companies out there that will sell insurance policies.
Well, those coverages aren't comprehensive, so they still have to pay a tax at the end of the year.
There are policies out. I mean, honestly, there are. Honestly, is it going to be everything for everyone? Is everybody going to get everything they want? No. No system can cover that.
But you're still absorbing those costs from those people that don't have coverage to the ER. I mean, you're dressing it up and you're saying, we're just going to look at this column, but you talk to the hospitals and stuff like that, they're going to see an increase in their ER that's unfunded.
I just don't think
it's absolutely true. People between 100 and 138%, those that don't have children, adults without children that won't be eligible, they're the ones that are going to be uninsured, even under the Affordable Care Act. It doesn't expand. If we expand Medicaid, those people would have an opportunity for coverage. But certainly at this point in Tennessee, those people are the people that are going to fall in the gaps. Those are the people who are going to show up at the hospital that we have to cover. But let's say under the Affordable Care Act, when you're talking about young people under 26, if their parents have coverage, then they're covered. But if the parents don't have coverage, they're not covered either. So, you've got young people that they're not eligible. I haven't heard of anyone that came to me and said, hey, I've called into the exchange, I've signed up for it, and all of a sudden I get this big rate increase or anything like that. Most of the people that call in didn't have access to coverage or either had a pre-existing condition that prevented them from even signing up for health care. So, it is helping people. I haven't heard any negative stories at all. All mine have been absolutely positive. And people have been getting their premiums reduced. Of course, a person that had a hospital policy, insurance, you can sell somebody and call a hospitalization policy and say, we're going to pay you $100 a day for each day you're in the hospital. That's not going to cover your costs. That's very inadequate. You might pay $10 a month for that policy, but guess what? And then when you go and actually apply for the true benefits of what a health care is, then yeah, you see your property increase. But let's compare apples to apples, And so in those situations, yeah, you see those examples, but certainly a Medicaid expansion would cover that cost and cover those folks.
I appreciate we have to be concerned about our rural hospitals and the fact that they may not be getting the kind of compensation they need for services they're getting. But do we know what 1% decrease in the amount of the federal, the 90% federal match, that the 90% federal government will give the state, would cost the state? So let's say they drop to 89% or 85% over time. Do we have an idea of what that would actually cost in real dollars?
I don't know about that cost, but initially, the first, yeah, it is available. I've seen it, but I don't
It's
remember.
pretty substantial.
But it never goes below 90%. And the first year it's a
That's the law written
4%.
now, correct?
As the law's written now,
Okay.
yes. I guess one thing I wanted to say to the other issue was talking about people being healthy. If you are able to go to the doctor and make an appointment at the doctor and not have to wait till you're incredibly sick to go to the ER, it's a whole lot easier to be healthy. It's a whole lot easier to fight obesity if you have a doctor giving you a plan of how to do that. The fact that people aren't allowed to see a doctor for those things are what makes it so difficult to have healthy Tennesseans. And so giving somebody an opportunity to actually see a physician will make a huge difference in healthy living in Tennessee.
Any other comments, questions? Really appreciate all of you being here this morning.